Nursing Exam Competence Test. Question 1. When discussing the correction of hypospadias in a newborn, what does the nurse explain about this condition? No intervention is required as the defect will correct itself over time. Surgical repair of hypospadias is typically performed before 18 months of age. Corrective surgery is commonly postponed until preschool age. Repairing the defect does not increase the risk of testicular cancer. B. Surgical repair of hypospadias is typically performed before 18 months of age. Correct answer: hypospadias is a congenital condition where the opening of the urethra is on the underside of the penis. Surgical repair is the primary treatment for hypospadias and is usually recommended to be done before 18 months of age. This timing is preferred for optimal cosmetic and functional outcomes. Waiting until preschool age for corrective surgery may increase the complexity of the procedure and potential complications. Correcting hypospadias does not impact the risk of testicular cancer. Question 2. The healthcare provider discussed strategies with a parent to prevent a recurrence of urinary tract infection in the child. Which statement made by the parent indicates a need for further teaching? My daughter should wash and wipe the perineal area from front to back. I am only going to have my daughter wear cotton underwear. It is acceptable to take frequent bubble baths. She needs to drink lots of fluids and void frequently. C. It is acceptable to take frequent bubble baths. Correct answer: in this scenario, option C, it is acceptable to take frequent bubble baths, indicates a need for further teaching. Bubble baths can irritate the urethra and increase the risk of urinary tract infections, UTIs, in children by introducing bacteria into the urinary tract. Therefore, this statement goes against the goal of preventing UTIs. Option A is correct because washing and wiping the perineal area from front to back helps prevent the introduction of bacteria into the urinary tract. Option B is also correct as cotton underwear helps keep the perineal area dry, reducing the risk of UTIs. Option D is correct as staying hydrated and voiding frequently help flush out bacteria from the urinary tract. In a pediatric nursing context, it is crucial to educate parents on proper hygiene practices and lifestyle modifications to prevent UTIs in children. Emphasizing the importance of these strategies can help parents play an active role in maintaining their child's urinary health and well-being. Question 3. What will the nurse caution the parents of a child who has had a nephrectomy that he will have to avoid? Contact sports, horseback riding, alcohol, diuretic medications. A. Contact sports. Correct answer: in the case of a child who has undergone a nephrectomy, which is the surgical removal of a kidney, the nurse should caution the parents that the child will have to avoid engaging in contact sports. This caution is important because contact sports pose a risk of injury to the remaining kidney due to physical impact or trauma. Protecting the remaining kidney from injury is crucial to maintaining the child's renal function and overall health. Option B, horseback riding, is not the most correct answer because while it does involve some physical activity and potential for falls, it does not inherently involve the same level of direct physical contact and impact as contact sports. Option C, alcohol, while generally not recommended for children, is not directly related to the risk of injury to the remaining kidney post-nephrectomy. Option D, diuretic medications, may actually be necessary post-nephrectomy to help manage the child's fluid balance and kidney function, so it is not something that the child necessarily needs to avoid. In a pediatric nursing context, it is crucial for nurses to provide thorough education to parents about post-operative care following a nephrectomy. By understanding the specific risks and precautions associated with their child's condition, parents can help ensure the best possible outcomes for their child's health and well-being. Question 4. The 6-year-old child scheduled for an orchiopexy shyly asks the nurse, "What are they going to do to me down there?" What is the nurse's best response? They are going to fix you up down there. They will move your testicle from your abdomen to your scrotum. What do you think your doctor is going to do? You shouldn't worry. Your doctor knows exactly what to do. C. What do you think your doctor is going to do? Correct answer. The nurse should encourage the child to express his thoughts and feelings about the upcoming surgery. This approach helps the child feel heard and understood while providing an opportunity to address any misconceptions or fears. By asking the child what he thinks the doctor will do, the nurse engages the child in a conversation that can help alleviate anxiety and build trust. School-age children often have fears related to bodily harm, and open communication can help alleviate such concerns. Question 5. The healthcare provider is explaining to a 17-year-old female the actions to prevent urinary tract infection. Which is the best beverage for the healthcare provider to recommend to keep urine acidic? Milk, grape juice, apple juice, orange juice. C. Apple juice. Correct answer. In pediatric nursing, it is crucial to educate adolescents on preventive measures for urinary tract infections, UTIs. The best beverage to recommend to maintain acidic urine, thereby preventing UTIs, is apple juice, option C. Apple juice contains ascorbic acid, which can help acidify urine and create an environment less conducive to bacterial growth, reducing the risk of UTIs. Milk, option A, is not recommended as it can make the urine less acidic due to its calcium content. Grape juice, option B, and orange juice, option D, are also acidic, but they are not as effective as apple juice in acidifying the urine. Educating adolescents on the importance of maintaining proper hydration and consuming specific beverages can empower them to take control of their health and prevent common issues like UTIs. By explaining the rationale behind recommending apple juice over other options, healthcare providers can help adolescents make informed choices about their dietary habits and promote preventive healthcare practices. This educational context ensures that adolescents understand the reasoning behind the recommendations and can apply this knowledge to maintain their urinary health effectively. Question 6. What is the probable cause recognized by the nurse when a 5-year-old boy is admitted to the hospital with acute glomerulonephritis? Recovery from German measles 2 months ago. Dysuria since the previous night. A history of allergy. A sore throat 2 weeks ago. D. A sore throat 2 weeks ago. Correct answer. Acute glomerulonephritis typically develops 1 to 3 weeks after a streptococcal infection, such as a sore throat, which triggers an allergic-type response that affects the glomeruli function. This immune response leads to inflammation and damage to the glomeruli, resulting in acute glomerulonephritis. Question 7. Which statement made by a parent of a child with nephrotic syndrome indicates an understanding of discharge teaching? I will make sure he gets his measles vaccine as soon as he gets home. He can stop taking his medication next week. I should check his urine for protein when he goes to the bathroom. He should eat a low-protein diet for the next few weeks. C. I should check his urine for protein when he goes to the bathroom. Correct answer. In nephrotic syndrome, monitoring urine for protein is essential as it helps track the child's condition. Checking urine for protein should be done as part of the discharge teaching to keep a record of the child's urinary proteins and to monitor the effectiveness of the treatment plan. It is crucial for parents to understand this aspect of care to ensure proper management of the child's condition. Question 8. What is an appropriate intervention for the edematous child with reduced mobility related to nephrotic syndrome? Assist the child in minimizing body movements. Change the child's position frequently. Maintain the child's bed flat. Keep edematous areas moist and covered. B. Change the child's position frequently. Correct answer. Changing the child's position frequently is essential for preventing respiratory tract infections and reducing pressure on delicate skin, which are common risks for edematous children with reduced mobility due to nephrotic syndrome. This intervention helps promote circulation and prevents complications associated with prolonged immobility. Question 9. A 6-year-old child with daytime enuresis complains of dysuria and urgency. What does the nurse recognize these signs and symptoms indicate? Urinary tract infection. nephrotic syndrome, acute glomerulonephritis, vesicoureteral reflux. A. Urinary tract infection. Correct answer. The signs and symptoms of dysuria and urgency in a child with daytime enuresis are indicative of a urinary tract infection. These symptoms, including urinary frequency and pain during urination, commonly point towards a UTI. Nephrotic syndrome typically presents with edema, proteinuria, hypoalbuminemia, and hyperlipidemia. Acute glomerulonephritis is characterized by hematuria, proteinuria, hypertension, and oliguria. Vesicoureteral reflux may lead to recurrent UTIs, but does not directly present with dysuria and urgency. Question 10. A parent tells the nurse that her child is scheduled for an X-ray of the bladder and urethra that is done while the child is urinating. What is this test known as? Cystometrogram, cystoscopy, voiding cystourethrogram, intravenous pyelogram. C. Voiding cystourethrogram. Correct answer. The correct test for an X-ray examination of the bladder and urethra before and during micturition is a voiding cystourethrogram. This procedure allows visualization of the bladder and urethra while the patient is urinating to assess for any abnormalities in the anatomy or function of these structures. Question 11. Parents are speaking with the urologist about their sons, the nurse to determine he understands the information presented. An undescended testicle can reduce fertility. The testicle usually descends spontaneously during the first month of life. Surgical correction reduces the risk for testicular tumors. The optimal time to surgically correct the condition is at diagnosis. A. An undescended testicle can reduce fertility. Correct answer. The correct answer is a because an undescended testicle can reduce fertility. Even after surgical correction, orchiopexy, fertility rates may be reduced, especially when one testis remains undescended. The statement in choice B is incorrect as the testicle should have descended into the scrotum by the time the infant is 4 to 6 months old. While choice C is true that surgical correction can reduce the risk of testicular tumors, the question focuses on the father's understanding of the information presented, which is better reflected in choice A. Choice D is incorrect because the optimal time for surgical correction of an undescended testicle is typically around 6 to 18 months of age, not necessarily at the time of diagnosis. Question 12. Which physical assessment technique should be omitted when caring for a 2-year-old child diagnosed with Wilms tumor? Performing range of motion exercises on lower extremities, palpating the abdomen, assessing for bowel sounds, percussing ankle and knee reflexes. B. Palpating the abdomen. Correct answer. In caring for a 2-year-old child diagnosed with Wilms tumor, the physical assessment technique that should be omitted is palpating the abdomen. Option B. This is because Wilms tumor is a type of kidney cancer that primarily affects the kidneys, and palpating the abdomen could potentially disrupt the tumor or cause discomfort to the child due to the proximity of the tumor to the abdominal area. Performing range of motion exercises on lower extremities, option A, is important for maintaining muscle tone and preventing contractures in pediatric patients. Assessing for bowel sounds, option C, is essential to monitor gastrointestinal function, which can be affected by various conditions including cancer. Percussing ankle and knee reflexes, option D, is a neurological assessment technique that helps evaluate the integrity of the nervous system in pediatric patients. Educationally, understanding the rationale behind omitting abdominal palpation in a child with Wilms tumor emphasizes the importance of tailoring physical assessments to specific conditions to prevent harm or discomfort to the patient. It highlights the significance of considering the underlying pathology when conducting assessments in pediatric patients to provide safe and effective care. Question 13. When teaching a parent of a child with contact dermatitis, which instruction should the nurse include? Apply a thick layer of antibiotic ointment to the affected area. Rub the skin vigorously with a towel to dry it. Keep the child's skin dry. Apply a thin layer of corticosteroid cream to the affected area. D. Apply a thin layer of corticosteroid cream to the affected area. Correct answer. The correct instruction for a child with contact dermatitis is to apply a thin layer of corticosteroid cream to the affected area. Corticosteroid cream helps reduce inflammation and itching associated with contact dermatitis. It is important to avoid using antibiotic ointment or rubbing the skin vigorously, as these can worsen the condition. Keeping the child's skin dry is generally a good practice, but in the case of contact dermatitis, corticosteroid cream application is more beneficial. Question 14. A child is being assessed for acute post-streptococcal glomerulonephritis, APSGN. Which of the following findings should the nurse expect? Hematuria, polyuria, hypertension, diarrhea. C. Hypertension. Correct answer. In pediatric nursing, understanding the assessment findings associated with conditions like acute post-streptococcal glomerulonephritis, APSGN, is crucial for providing effective care. In this scenario, the correct answer is C. Hypertension. APSGN is characterized by hypertension due to fluid retention and decreased urine output. This is a key indicator of renal involvement in APSGN. Option A. Hematuria is a common finding in APSGN, but it is not the most specific or defining characteristic. Option B. Polyuria is unlikely in APSGN due to decreased renal function. Option D. Diarrhea is not typically associated with APSGN. Educationally, understanding the hallmark signs and symptoms of APSGN helps nurses differentiate it from other conditions with similar presentations. This knowledge enables timely identification and intervention, leading to improved outcomes for pediatric patients. Nurses must be adept at recognizing subtle changes in pediatric patients to provide prompt and effective care. Question 15. A parent of an infant with diaper dermatitis is being taught by a nurse. Which of the following instructions should the nurse include? Use baby wipes that contain alcohol to clean the baby's skin. Expose the baby's skin to air. Use a blow dryer on the warm setting to dry the baby's skin. Give the baby a bath once a week. B. Expose the baby's skin to air. Correct answer. In pediatric nursing, providing education to parents is crucial for the proper care of their children. In the case of diaper dermatitis, the correct instruction for the nurse to include is option B. Expose the baby's skin to air. This is because allowing the baby's skin to be exposed to air helps in promoting healing and preventing further irritation by keeping the area dry and reducing moisture, which can exacerbate the dermatitis. Option A is incorrect, as using baby wipes that contain alcohol can further irritate the baby's sensitive skin and worsen the dermatitis. Option C is also wrong, as using a blow dryer on the warm setting can be too harsh on the baby's delicate skin and may cause further irritation. Option D, giving the baby a bath once a week, is not the best instruction for diaper dermatitis. Frequent bathing can strip the skin of its natural oils and disrupt the skin barrier, making it more susceptible to irritation. Educational context should emphasize the importance of gentle skincare practices, keeping the diaper area clean and dry, and using barrier creams to protect the skin. Encouraging open communication with healthcare providers for ongoing support and guidance is also essential for parents caring for infants with dermatitis. Question 16. During an assessment, an infant is suspected to have intussusception. Which of the following findings should the nurse expect? Current jelly stools, projectile vomiting, scaphoid abdomen, frequent stools. A. Current jelly stools. Correct answer. Intussusception is a condition where one segment of the intestine telescopes into another, causing obstruction. The classic presentation includes current jelly stools, which are a mixture of blood and mucus due to the sloughing of the intestinal mucosa. This finding is a result of the compromised blood supply to the affected area and is a key characteristic associated with intussusception. Question 17. When teaching a parent of a child with hemophilia, Which of the following instructions should the nurse include? Administer aspirin for pain. Avoid administering NSAIDs. Restrict physical activities. Apply heat to joints. B. Avoid administering NSAIDs. Correct answer. The correct answer is B. Avoid administering NSAIDs. Hemophilia is a condition where blood does not clot properly. NSAIDs, nonsteroidal anti-inflammatory drugs, can increase the risk of bleeding in individuals with hemophilia. Therefore, it is crucial for the parent to avoid giving their child NSAIDs for pain management to prevent exacerbating bleeding tendencies. Question 18. A healthcare professional is planning care for an infant who has a colostomy. Which of the following actions should the healthcare professional take? Change the ostomy pouch every day. Use baby wipes to clean the stoma. Avoid using soap to clean the stoma. Apply barrier ointment to the skin around the stoma. D. Apply barrier ointment to the skin around the stoma. Correct answer. When caring for an infant with a colostomy, it is essential to apply barrier ointment to the skin around the stoma. This helps in preventing skin breakdown and irritation caused by exposure to stool or urine. Changing the ostomy pouch as needed, using appropriate cleaning supplies such as warm water and mild soap, avoiding harsh chemicals like alcohol, and ensuring gentle cleaning of the stoma with a soft cloth or gauze are also important steps in colostomy care. Using baby wipes may not be recommended as they can contain chemicals that may irritate the sensitive skin around the stoma. Question 19. A parent of a child with HIV is being educated by a healthcare provider. Which statement by the parent indicates an understanding of the teaching? I will notify my child's school about their condition. I will give my child the prescribed antiretroviral medication at regular intervals. I will expect my child to receive yearly immunizations. I will bring my child in for yearly skin testing. B. I will give my child the prescribed antiretroviral medication at regular intervals. Correct answer. In this scenario, option B, I will give my child the prescribed antiretroviral medication at regular intervals, is the correct statement indicating the parent understands the teaching. This is crucial in managing HIV in children as antiretroviral medications help suppress the virus, improve the child's immune system, and overall health. Option A is incorrect because disclosing a child's HIV status to the school may violate privacy laws and could lead to stigma and discrimination. Option C is incorrect because children with HIV may have specific immunization guidelines due to their condition. Option D is incorrect as skin testing is not a routine procedure for children with HIV. Educationally, understanding the importance of adherence to antiretroviral therapy in managing HIV in children is essential for parents to ensure the best possible outcomes for their child's health. Teaching parents about the specific care needs for children with HIV empowers them to provide optimal care and support for their child's well-being. Question 20. A healthcare provider is assessing a child with acute lymphocytic leukemia. Which of the following findings is the priority for the healthcare provider to report? Bruising, petechiae, elevated WBC count, elevated platelet count. B. Petechiae. Correct answer. The priority finding to report for a child with acute lymphocytic leukemia is petechiae. Petechiae indicate a low platelet count, which increases the risk of bleeding. Therefore, the healthcare provider should promptly report petechiae to initiate appropriate interventions to prevent bleeding complications. Question 21. A parent of a child with oral candidiasis is being taught by a nurse. Which statement by the parent indicates an understanding of the teaching? I will boil the nipples and pacifiers for 20 minutes each day. I will stop the medication as soon as the spots disappear. I will apply an over-the-counter steroid cream to the spots. I will mix the medication in my child's bottle. A. I will boil the nipples and pacifiers for 20 minutes each day. Correct answer. Boiling the nipples and pacifiers for 20 minutes each day is an appropriate measure to prevent reinfection of oral candidiasis. This practice helps eliminate the Candida fungus from these items, reducing the risk of the child getting reinfected. It is crucial for the parent to follow this hygienic practice consistently to ensure the child's recovery and prevent the spread of the infection. Question 22. A healthcare professional is assessing an infant who has heart failure. Which of the following findings should the healthcare professional expect? Weight gain, bounding pulses, hyperactivity, increased urine output. A. Weight gain. Correct answer. In infants with heart failure, one of the key manifestations is weight gain due to fluid retention. The heart's inability to pump effectively can lead to fluid buildup in the body, causing weight gain. Bounding pulses, hyperactivity, and increased urine output are not typically associated with heart failure in infants. Question 23. A child has Wilms tumor and is scheduled for surgery. Which of the following actions should the nurse include in the plan of care? Palpate the child's abdomen daily for tumor size. Reposition the child frequently. Prepare the child for chemotherapy. Avoid palpating the abdomen. D. Avoid palpating the abdomen. Correct answer. In caring for a child with Wilms tumor scheduled for surgery, the nurse should include avoiding palpating the abdomen in the plan of care. The correct answer, option D, is essential to prevent the risk of tumor rupture and dissemination of cancer cells. Palpation can potentially lead to seeding of tumor cells into adjacent tissues or blood vessels, increasing the risk of metastasis. Repositioning the child frequently, as an option B, is a general care measure to prevent pressure ulcers, but is not directly related to the child's condition or surgery. Option A, palpating the abdomen daily for tumor size, is contraindicated as it can cause harm as mentioned earlier. Option C, preparing the child for chemotherapy, is also incorrect as the child is scheduled for surgery, not chemotherapy. In a pediatric nursing context, it is crucial to prioritize interventions that promote the well-being and safety of the child. Understanding the specific needs of a child with Wilms tumor, such as the risk of tumor manipulation, guides the nurse in providing safe and effective care. By selecting option D, the nurse ensures that the care plan aligns with best practices and minimizes potential complications for the child undergoing surgery for Wilms tumor. Question 24. A child with suspected bacterial meningitis is under the care of a nurse. Which action should the nurse prioritize? Administer antibiotics as prescribed. Maintain the child on NPO status. Monitor the child's intake and output. Implement seizure precautions. D. Implement seizure precautions. Correct answer. The priority action for a child with suspected bacterial meningitis is to implement seizure precautions. Meningitis can lead to increased intracranial pressure, which may trigger seizures. By implementing seizure precautions, such as padding the side rails of the bed and ensuring a clear environment, the nurse aims to prevent injury during a potential seizure episode, prioritizing the child's safety. Question 25. A caregiver is seeking guidance from a healthcare provider concerning a child diagnosed with impetigo. Which of the following instructions should the healthcare provider include? Apply warm compresses to the affected area. Keep the child home from school until lesions are crusted over. Apply antibiotic ointment to the lesions. Cleanse the affected area with hydrogen peroxide. C. Apply antibiotic ointment to the lesions. Correct answer. The healthcare provider should recommend applying antibiotic ointment to the lesions to prevent the spread of infection and facilitate healing. Antibiotic ointment helps combat the bacterial infection associated with impetigo and supports the skin's recovery process. This approach aids in reducing symptoms, preventing complications, and promoting a quicker resolution of the condition.